you see more than 1 million patients every single year, but so far you've had no cases of coronavirus.
Amazing. We've screened many, but absolutely no positive cases at this time.
Well, that's wonderful news, and I think a lot of people, doctor, right now are panicking. I know, you know, my parents are a little older; they're in that target group. What is the number one? What is your soapbox that you want people to take away from this? Is stay calm and carry on, but we know about, you know, the sanitizing wipes. What's the best way to really handle the situation we're in today?
Well, I mean, I think you need to just distance yourself from people who are sick. So if you're in that elderly population, you certainly do not want to go visit a grandchild who's got a runny nose and fever just to console them and help the mom in kind of child care. I mean, that would be putting yourself in harm's way. So wait till everybody gets better, talk to them on the phone, but don't put yourself in a situation where you may be exposed to something.
And if you do find yourself around people who are not feeling well, a lot of people are asking the question, what should we do? And one of the steps that you guys have mentioned is the identification of what may be COVID-19.
Absolutely. We have a screening process when individuals are actually entering our hospitals, to where we're screening them. We're asking them 3 simple questions. And if they are positive for any of those questions, we're asking them not to visit their loved ones. And so I would recommend that individuals out in the community follow that same process.
Well, let's talk about the 3 steps to process and identify and assess COVID-19. And the first one you say is that identification, right?
Right. And so we ask the patients, are they having any symptoms? Are they having any fever, any flu-like symptoms? And then we're asking them about their travel history, and then if they've been exposed to anyone that has had or has COVID-19.
Then it would be isolation. That would be the next step after that.
Absolutely.
And what does that involve? I mean, does that mean we are staying home, or does it need to go farther than that?
So I think it depends on the setting. So when a patient is coming in the emergency room seeking care, and it may be for this respiratory symptoms that they're having, what we will do is we'll actually put a mask on the patient so they don't infect anybody else. We'll put them into a room, close the door, and then we will wear protective equipment, mask, gloves, gown, before we go in there. If you have these symptoms and you're a visitor, you're not really even sick, you say, yeah, I've not been feeling well, I have a little bit of fever, we ask that you go home. We don't really want you in the hospital potentially infecting people.
Of course not, yeah.
And then the third step here would be the inform part, and that is basically how you know who you've been in contact with.
Absolutely. We want the individuals to inform who they've been in contact with, and then we have a process within the hospital that we involve the appropriate specialist to make sure that we're taking the absolute best care of those patients that we can.
And of course, these steps are if you think you may have been exposed, right? But let's talk a little bit about prevention. We're hearing a lot about hand washing and ways that we can all protect ourselves. So the first step, is that just washing your hands?
Absolutely, hand washing. And I know that not everybody follows the rules like they should. So you need to clean your fingernails, back behind your thumbs, on the top of your hands, and then also pay close attention to your wrist. And you need to scrub for 20 seconds.
Oh, to your wrist, that's interesting.
Listen, it's like I'm going into surgery. I'm up to the elbows already. I mean, I'm telling my kids all the way up, you know? I feel like more is more.
Is the wrist an area because people are wiping their noses with it?
Well, you know, the wrist is just an extension of your hand, and so you just kind of do this, you fiddle with your watch and, you know, stuff like that. So if your wrist is dirty, it's going to get on your fingers.
Wow, I'm not washing high enough.
I know. And here's the other thing, too. I think, you know, when we are talking about this during flu season, regular cold and flu season, we always say lack of sleep breaks down our immune system. If we're not eating well, or maybe we're kind of running not on all cylinders, that's when we see our own immunity. And this is the same thing that we should be talking about today.
Correct. I mean, we don't have a vaccine against the coronavirus, but there's a lot of common sense things that you can do. It's exactly as you said. Get sleep, you know, eat well, you know, exercise, all the routine things that you do to try to keep yourself fit. And again, wash your hands. If you don't have soap and water, use an alcohol-based hand sanitizer.
And not vodka, right? We've already talked about that. Do not wash your hands with vodka. When you mention exercise, some people might be wondering, well, wait a second, should I be avoiding the gym and areas where there are a lot of people touching a lot of surfaces?
And that's actually been looked at. If you are going to go out to the gym, take some wipes. You know, wipe down the equipment before you use it and when you leave. I mean, that's just certain etiquette that you should have. But you can certainly, you know, you can take a walk, you can take a little jog around.
Get outside.
Get outside. The weather's nice. Get some fresh air, yeah.
Absolutely. Okay, so then as far as preventative things too, also see a doctor. if you have any of these symptoms, correct? I mean, immediately.
Right. And you want to actually call the doctor
Yes.
ahead of time. You want to let them know that you're coming. The doctor doesn't particularly want you in their office spreading it to other people either. And it may be something that can be handled over the phone. It might be a flare-up of allergies. It could be something that could be managed over-the-counter medications or even with a prescription, but it could be managed without going into the doctor's office.
And if you do need to go see the doctor, you also recommend taking some form of private transportation, like a car, right?
Absolutely. Don't
ride the bus or the train if you are sick and experiencing symptoms because you're out exposing other people.
Right.
That's just common sense. You want to keep what you have to yourself.
Well, you know, this is certainly unprecedented, what we're dealing with today. And I feel like, as we were saying, it's sort of fluid. Things are changing minute by minute, hour by hour. We're learning more. What can you shed the light on about what you're learning? I mean, are we able to get more of these tests? I mean, we should mention that the testing for this actually goes to the health department. Y'all aren't doing those tests.
Right, and I think we just heard the press conference with Dr. Kaiser from Galveston County, and again, UTMB has sort of got some internal testing, but they don't really have commercial testing either. So when we want a specimen tested for the coronavirus, we actually send it to the health department. Now, there are some commercial labs that have just this past week started to offer this test, but that's still something we have to send to them, the sample to them. We don't actually have the testing in our hospital. So don't come to our hospitals thinking we can test you and tell you, yes, you're negative, and then send you home. We actually do not have the capability of doing that anywhere in the city.
Yeah.
And I think even the labs that are testing only have the capacity to test about 15 to 20 a day, which is not very many.
Not at all.
I mean, you can add that up very quickly.
And we have heard a lot of conflicting information about tests being widely available when they're actually not. Oh, go ahead, Doctor.
I was just going to say there are many more on the way. We hear about this on a constant basis. There are some stand-up testing centers that we heard Governor Abbott talk about earlier today at his press conference, but it's still going to be a week or two away.
Let's just underscore the fact that although you guys have not seen any of these cases yet, you are totally staffed up. You are prepared for anyone who may come through the doors infected with COVID-19.
Absolutely. We've been doing drills and really preparing for an event such as this. And as we like to tell our communities as well, we care for these type of patients every single day. We unfortunately have infectious patients that present to the hospital and need care, and we are happy to care for them. And Dr. Vartian and I both would be happy to care for a COVID-19 patient. This is what we do every day, and it just comes easy for us.
And we should mention, you guys treat almost 1 million patients each year within HCA.
Right.
Yeah, it's really incredible.
It's a lot of people that we take care of.
Absolutely.
But it's such an honor.
We are tight on time, but one last question, seeking advice. When we're going out to restaurants, is that okay? Is it okay to move through the community to go grab a drink with a friend, or should we all be feeling like we need to just stay at home until further notice?
No, I would definitely tell you, if you're healthy, you're not in one of these high-risk groups, you don't have severe underlying medical conditions that would be exacerbated by any kind of minor illness, by all means get out and about. When we talk about the infectivity, it's really within a zone of about 5 to 6 feet of someone who's infectious. So I mean, just being in a room is not going to expose you. If somebody at one end has this, you're not going to get on the other end, even if that person were positive. So people just need to relax a little bit, get out, enjoy yourself. And you were talking about going out to restaurants. I'm all for that.
Great, great.
Live your lives, people.
Exactly.
Right?
Keep calm and carry on.
Dr. Carl Vartian, thank you so much. Kelli Nations, thank you for keeping us safe, and thanks for the added information.
Absolutely. Appreciate the conversation. For more information, visit HCA HoustonHealthcare.com/COVID-19.
And Houston Life will be right back.